मम्मी रे वो घर जगन्नाथ मोह ने पिया जगन्नाथ ने पिया देना नहीं तो પછી માં વીજ ની પી જાય.
So good morning, and a very interesting topic for today, because this topic would be the foundation for next time's topic. In fact, next 3 topics, they are based on today's topic. Exactly, it is now 10:30. Let's start. Now, before we start, some quick questions. I haven't replied to many of the emails because what I thought is that things were common, so let me answer all those things in general. One was regarding the MBBS abroad, feeling low, feeling depressed, so many things you say. Then I saw, I'm not taking anyone's name, but yeah, it is that email is in front of me, where it is said that वहाँ पे तो nurse जैसा education है वगैरह वगैरह. One simple thing. You go in any part of the world. Well, in India, education would definitely be better, no doubt about it, but it comes at a huge cost. One. Second, say over here, education is good. Agreed. But then finally, it is like you'll be given a very nice dish, but you have to eat. Correct? So whether it is over here or it is in any part of the world, the point is how much you can digest, how much you can understand, and how much you can express and implement. That's what MBBS or any other field is about. So no need to feel low or depressed or confused. कि मैं क्या करूं? No. If you have decided, you have taken the admission, fine. Now go ahead and straight away be a doctor. Right? Time to time, I'll keep on telling you not to trust those people, those who are telling कि अभी पढ़ने की जरूरत नहीं है. Why to struggle so much? इतना सा पढ़ लो चल जाएगा. Think in a long-term perspective, because if you are in front of a patient and he shows you the ECG and then you feel like यार शर्म से डूब मरो, ना भी नहीं आता. Right? That should not happen. Bus. That's what I'm telling. So at this point of time, don't worry about one exam. Don't worry about whether I'll be able to do it or not, or any other confused or the frustrated state. Because the more you'll be frustrated, the more you'll be depressed, the lesser will be the bus. So don't do that. So yes, about the low B12 and D3. And you must have seen your report in 3 of the emails when the D3 level is less than 20, and in 2 emails where you have sent your email, I have sent your report, it is less than 10. My friend, what are you doing? Less than 10, it is dangerous. Right? Regarding this email that I'm going to gym, what should I take? I'll answer you that. Regarding the B12, right? If the B12 is less, if the B12 is less than 200, start taking this medicine, right? These are the sublingual, right? They are the sublingual. So you just put it under the tongue, it will dissolve. Fine, right? They are called as the Mbbs. Mbbs. These are very cheaply available, not that expensive, and just 1 tablet a day. That would be sufficient, because it is water soluble, so nothing to worry about the overdose or side effect. Kuch nahi hota, right? Second, regarding the D3, if your D3 is into this dangerous level, that is, in short, if it is less than 25, in fact, in only one person's email was more than 25. Otherwise, everyone is either in the range of less than 10, just 2 people, and many of them are in the range from 10 to 20. Now, this is very low. Right? We'll discuss about the D3 level, why it has gone so low, etc. That has been the stage, but start this treatment immediately from today, right? It is called as the tablet cholecalciferol. Cholecalciferol. Right? It comes in 60,000 IU. IU stands for international unit, right? 60,000 international unit. There would be one pack. This pack would cost you about 60 to 70 rupees, right? One pack. There would be 4 tablets, and you have to take just 1 tablet per week. For these friends, right, whose level is less than 10, they should take like this. Say for example, today is Tuesday, so take 1 tablet Tuesday or Wednesday. So either by today or tomorrow, but do it. And then second one on Sunday. For rest all, you decide whatever the day you want to take once a day. This particular tablet once per, not a day, I'm sorry, once per week, right? By mistake, so I'm just writing. Once per week. Just a minute, just a second, just hold on. So it is once per week, only 1 tablet. So you decide, let's say if it is Sunday, so every Sunday you will take 1 tablet, and you will be continuing this thing for 3 months. 3 months. Those whose level is less than 10, be very clear. If the level is less than 10, then you will be taking every Tuesday, every Sunday, right? So that way, it has to be taken only for 1 month, and then once I'll write it clearly over here, less than 10. So this is just an example. Tuesday, Sunday, 1 for 1 month, right? Between 10 to 12, you take 1 per week, and you have to take it for 3 months. Right? Clear? No confusion. 12, your vitamin is 12. It should be 30. It should be 40 plus. Right? It should be 40 plus. So if it is 12, then just consider this one less than 10. Right? Just consider it. 12 is exactly like just the borderline. So take this. You need to take this loading dose and do this. And this is cholecalciferol. Right? Its name is cholecalciferol. I wrote it. Cholecalciferol. And it comes in various strengths. You have to go for 60,000 international units. It comes in pack of 4. So accordingly, you can just calculate, right? They will be requiring 3 packs, and just take those packs because they are not expensive. Right? Hardly 200 rupees mein you'll get that complete course for 3 months. It is that cheap. No doubt there are some expensive versions also, but that is probably your choice. But otherwise, standard dawai that comes in the range of about 60 to 70 rupees. Right? So that much is the cost. So for low B12 and B3, this is the treatment, and you have to start immediately. Okay, regarding books, again, at this point of time, BD Chaurasia, all volumes, and obviously the latest edition, because you are buying new. If someone is giving you, I would say even if it is 3 editions old, chalega, no problem. Things won't change much. But yes, if you are buying new, so then this is a normal policy. If you're buying any book, always go for the latest edition. If someone is gifting you, so then whatever is given is fine, right? Because even if you absorb that much, that would be more than enough. More than enough. And regarding the Guyton, yes, there is no force or compulsion that you buy Guyton. I would say that even if you don't buy any book for next 2 months, no problems. Whatever we'll discuss, that would be fine, right? Acha. This BDS homeopathy, I should say in Georgia or in any part of the world, right? I don't know the latest edition. Rahul, at least that you have to figure out. And regarding the Guyton, yes, Arya, always, I would say, this is what I say. I used to buy Asian edition. Asian edition, their paper quality is bit low. Content, no different. If you go for international edition, yes, they are the bond paper, right? Superb papers. But the cost is 5 times. Purely depends upon your budget. But say, I used to say that, okay, go for Asian, but you people can just in any case. Thanks, Palak. BD Chaurasa's latest edition is like that. So, next, 3 emails regarding this, whether I have combined everything. Confused about that, whether should I go for BDS, right? Or homeopathy, or someone said Ayurvedic is good, or to go for Mbbs. Point. Homeopathy, Ayurvedic, I'm not at all against, right? Not at all. From my perspective, say in many of the cases, yes, we do rely on the, say, Ayurvedic, and we do respect it. But trust me, when it comes to career, nothing beats this. First, just look at what are the new inventions, what are the new things which are coming up. So all you need to do is, say, without, say, getting deviated by anyone, that go for homeopathy or go for Ayurvedic. No, don't fall into any of those controversies. Be crystal clear that what you really want to do. If your father is Ayurvedic doctor and if he is insisting, and if you really like it, say, I don't have any objection. No problems. Definitely there will be huge difference between the course of Ayurvedic and Mbbs, right? In Ayurvedic, bath with cough, right? Those things, they rely on that. But let's say if there is a cancer, right, for carcinoma, whatever is said, right, whatever is said, people give all sorts of claims. But if I know few of the patients, they are having brain tumor. They have wasted lakhs of rupees going to this Ayurvedic, and they give all sorts of things. Nothing happens. No, it never. Even there is no medicine even in our Mbbs. Correct? In allopathy, you have to operate it. You have to really remove that mass, that soap space occupying lesion as well. So things are very crystal clear. Things which are good at their place, they are good. But if someone is trying to overclaim the things, I just say, Are one person, when I read your mail, I don't know you are there or not. Oh yeah, you are there. Man, why you gave meat for 4 times? Are you crazy? Pagal hai? Decide. And why doing this? Be very clear. See, एक बार अगर जो कभी भी कोई प्रॉब्लम हुआ, ठीक है, you appeared for second time. But ये तीसरी बार, चौथी बार, मतलब I mean the 4 years तो 4 साल तो इसी में चल रहा है. What's the point? ठीक है. Failure, I would not consider that you were a failure. I would just consider that proper guidance was not given. Maybe if this is not the field what you are say pursuing, you want to think of something else, do it. Don't. It's like if you keep on repeating the same mistake, you will get the same results. I think I have answered your question. Right? Remember, if you keep repeating the same mistake, you will get the same result. It won't happen that, chalo, next time when you repeat the same mistake, something else would come up. No, same thing will happen. Right? This was crazy. When people say कि body में heat बढ़ गई है, हड्डियों में बुखार घुस गया है, सर में हवा भर गई है, right? All these things, they are like all those layman terms. Say body heat. So sometimes when you measure the temperature, they say कि temperature normal पर मेरे अंदर बुखार है. That is nothing. That is called as the feeling of malaise. When the body is, you feel a bit weak. Fever in bones, no, there is nothing like fever in bones, right? Nothing like it. Is just a lactic acid accumulation which gives that pain in the muscles and which is perceived as the pain, is perceived as the bone discomfort. Otherwise, it is a problem of muscles. Air filled and head, no. Head is airtight because if the air goes inside, right, so many complications can occur. Where the air really goes, it goes into the sinuses. Like it goes into the sinuses, and that is what is called as the sinusitis. We have got the frontal, right, ethmoidal sinus, sphenoidal sinus. So all those sinuses, they are like blank space, and these blank space, they are coated with the mucus. When they are filled up, right, when they are filled up, say for example, even a common cold. So when they are filled up, so it will lead to heaviness of the head. And second, it will take away these sinuses, they make your head light, right? Because it has to hold that heavy brain. So it makes the head light. At the same time, it gives resonance to the speech. Right? Otherwise, if it is, say, if you are suffering from common cold, then how the sound becomes low, right? There is no vibration. That vibration goes away. So all these things, so no worries. Regarding this one point, that is, the gentleman, if you are going to gym, I'm not telling that you straight away start taking the B12 or B complexes without even thinking about it. Keep the food good, right? Protein is more important. If you are going to gym and if you are a heavy gym hitter, then you need to go for the good protein. Creatinine is something which can be used, right? Creatinine is a very powerful pump. Just because you wrote it in detail, so that is creatinine. It's called as the creatinine monohydrate, right? Creatinine monohydrate. And as per the newer studies, previously it was like that you need to go for loading dose. You need to go for large amount of creatinine initially and then gradually increase. Now the concept has changed. If your weight is less than 180 pounds, right? Less than 180 pounds. So if it is in the range of about 70 or 75, less than 75. So then you need to take 5 grams of creatinine per day. You can take it in water, you can take it in, because it is tasteless, right? White powder. So it is, you can take it in juice, you can take it in protein, and you can take it anytime. There is, like people say that you do it immediately after gymming. No, there is no point. There is no point if you do it after gymming, because this is not like injection intravenously. You go into the stomach, from there it will come into all those vessels. From there it will be taken all the way to the liver will metabolize, and then it will come into the hepatic veins, and then into the vena cava, then into the circulation. It will be picked by interstitial tissues, then it will go to the bone, to the muscles, and then it start taking. It takes time. Well, PCOD, don't take. Right? For you, the best protein would be what is called as it is bit costly. It is bit costly. It is whey protein isolate. This is Regarding entrance exam, please, you have to ask your consultant and they will be able to give you the course that what do they ask. But normally, it would be the biology and the chemistry. They will be emphasizing on these two subjects. What else can they ask? They won't be asking about the pediatrics. I'm taking your name, Vedant. Don't ride on two horses. That's what I said, that you want to do MBBS and you want to go for the Ayurvedic also. No. Stick to first one concept. Make it very clear, strong, proper. Uske baad abhi nahi. I won't encourage you. If there is hair fall, then biotin. Nothing else. Biotin. Go for biotin. Biotin is something which is taking care of the keratins. Right? So biotin is the best. All right. So I think that completes all the questions. This was one of the questions. Do I conduct personal training and USMLE or MBBS? Well, there is a batch which is going on. And abhi ke liye to abhi to we are studying. Na? So right now this is free. To aaram se padho na. When it will come, when it will be needed, in case if you need that personal training, just send a mail to me. Right? We'll see. But I'm trying to cover. Yes, in personal training, so that is completely a different thing. That is like I take responsibility for all the years till you complete your MBBS, irrespective of whether this batch continues or not. So that is a completely different. Okay. So we start now with our today's topic. And today's topic is cell membrane. Now, in cell membrane, we'll be touching those topics which will be taking care of the physiology, not only physiology, pharmacology, medicine, diagnosis. Reneat, I told you, you can attempt once if you like. And only if you have felt that pehli baar mein, my preparation was not that up to the mark, yes, I can do better. Otherwise, if there is even a slightest doubt, don't waste your 1 year. Right? 1 year is important. We are not recording this lecture. My dear, we are not recording this lecture. That's the important thing for that's the live. Anyway, so today's lecture to end. We'll see after the rest of this. So here it is the cell membrane of the cell, right? That is what is called as the cell membrane, right? Very easy. So in cell membrane, there are two layers. So it is a bilayer. That means there will be two layers. And these are the bilayers of phospholipids. Phospholipids. That would be the bilayer. Now in this, there would be one concept of what's called as the receptors. Right? Receptors. Next time, or very soon, next time I'm planning to take sodium potassium pump. But receptors, they will be touching that concept. We'll be taking one full week only for receptors, and we'll be discussing all the receptors, all, right? We'll not leave even one single receptor, because all those receptors, they will give you understanding not only in physiology, but most important in the pharmacology. Very interestingly, pathology. These are the subjects. Then medicine. And in medicine, your diagnosis, that will be very fun. It will make a big difference. So cell membrane, which is made up of our entire body, is a combination of, say, proteins, carbohydrates, and the fats. Right? Yeah, or the lipids. Out of this, when we say protein, so protein, they are the building blocks. They are the building blocks. Whenever there is any injury, so that protein would come and it will repair. So that's why if you see during gym, when you do heavy gymming, that means it is the injury to the muscle. It is called as a micro injury, and that's why the protein is needed. But you drink the protein and immediately the muscles are back to normal. No, it will take time. So this protein is about 55%. than half, 55%. Carbohydrates, they are about 5%, quite less. And these lipids, they are rest, about 40%. So here is the cell, right? Here is a cell. And we say that outside is extracellular fluid and inside is the intracellular fluid. Now, it's like we take one piece, right, and we draw it over here. And this time we'll be drawing it like this, 2 layers. So just consider this thing is a cell membrane. So here it is the ECF, and here it is the ICF and extracellular fluid and the intracellular fluid and blood. This part is called as the polar. Polar means there is some charge. Right? Extracellular fluid and interstitial fluid same. Yes. But when we are talking about the, because in blood it becomes different. So that's why we use this broad term. Extracellular outside the cell, right? Whether it is muscle or it is blood. So here it is. This is a polar. Polar is a charged one. So with charge, positive or negative, whatever, right? It could be positive, it could be negative, but it is a charged one. Right? And this portion, that is hydrophilic. It is called as a hydro. Hydro means water, philic means it loves water. Right? This in-between portion, it is hydrophobic. It's hydrophobic. Phobic means fear. Right? Fear. The way we say claustrophobia. So claustrophobia means fear of closed space. Right? And that's why it is lipophilic. It loves lipids. Right? It is lipophilic. So that's a basic structure. Hydrophilic head and hydrophobic tail. Very right. And similarly the vice versa over here. You're right. So when we say about this, we need to take care of this concept that this is the cell membrane. This is the cell membrane, and in which we saw that yes, this is like, right, there are 2 layers, right, and such big complete ranges there. Who can cross this thing? One. Those who are lipid soluble. So will the hydrophilic be lipophobic? Yes, that's right. That's right. So they should be lipid soluble. Right? Who can cross? Right? Concept. Who can cross? Right? One, who is lipid soluble. Second, whose size is small. That is small molecular weight. Right? Small molecular weight. This is like that a kid, they don't have to buy their extra ticket, right? They are so small, they are accommodated. So same thing over here. Right? Those small molecular weight, they just squeeze in and they will go inside. And third, who is neutral? Right? Neither positive nor negative. That means we'll be calling them uncharged. They'll be uncharged. So if this surface is negatively charged and the negative one comes, so right, the negative would repel, the hill say, right, won't allow to go in. If the positive charge comes, the hill say, you are so cute, come. It won't let him go, right? So this is what really happens. Neutral, uncharged, they will be going easily. So these 3 concepts, they will be playing a major role when we'll talk about the pharmacology. But not all the substances are like that. There would be some substances which are totally reverse, totally ultra than this. They will not be lipid soluble, they'll be water soluble. They are not small molecular weight, they are large molecular weight, and they are charged particles. So then what to do? So that's the reason for such there would be a special arrangement. This special arrangement is for one, water soluble. Who are water soluble, those who are having large molecular weight, and the third and important one is that those who are not neutral but charged particle. Now, because they are special, so that's why there must be special gates for them, right? Those gates. And say, first thing first, for the water there is so important. So for water, there is a channel channel is nothing but like a tube, right? So if it is like this, so they'll say, let's say over here, this. These are all cell membranes. It will say, right? Why do you want to cross from here? And this is the place for you. So just enter and come on this side. So these are the spatial channels which are there. But if we speak like that, okay, this is a water channel, doesn't look very impressive. Right? Doesn't look very impressive. So that's why it is called as the aqueous channel. Right? Aqueous channel. It is same name, Baba. Right? Aqueous channel, that means it is a water channel. And yes, you are right. These are the channels which are made up of proteins, right? Peptide proteins. So they will be like this, this. So surrounded by protein, and in between there is a space, and through that the water will pass. So these aqueous channels. Regarding the sodium, potassium, we'll just talk about it. So because they are charged particles, so for them the mechanism is different. Let's understand this cell membrane a bit more properly. So we just said that it is the cell membrane, which is divided in outer. So this was like this, and the inner half, which was like this. So that's how it was. This outer one is divided into parts. There are two types. One, what is called as the phosphatidyl. Are these names to be remembered? Definitely. Phosphatidyl choline and the sphingomyelin. And about the inner one, so again there is the phosphatidyl. So it is the phosphatidyl. Over here it was choline. Over here it is ethanol. It's ethanol amine. And the way over here it was sphingomyelin, here it is phosphatidyl serine. I said serine and seriol. Okay, so cell membrane, so that's how it is divided into two parts. Outer, take care speaking this. So this is phosphatidyl, SERIN. So outer and inner. Outer part is different, inner part is different. What other molecules also pass with water channel? No, this is like a special gate. Only that will pass for whom it was made. Right? That's why when we'll be discussing about more in detail about the receptors, in fact today also it will come. So here it is. Yes, it is there. So the point is, this is called as the membrane asymmetry. Membrane asymmetry. It means that outer membrane is not similar to inner membrane. They both are different. Now see these phosphatidyl molecules. say outer and inner phosphatidyl-choline and sphingomyelin and phosphatidyl-ethanolamine and phosphatidyl-serine. These are the four important components of the cell wall. Now these, because they both are different, that's why it's called as the membrane asymmetry. Now these phospholipid molecules, right, these are all phospholipid molecules, they move or they glide, right? They glide. So this is what is called as these phosphatidyl molecules, once they are laid, once that it is formed, it is not so that they'll just remain steady, right? So this is in general phospholipids, right? Phospholipids. They will glide over each other. And this is what gives flexibility. They glide over each other. And this concept of gliding, that is when one layer it glides over the second layer, and that is what is called as the fluid mosaic model. Fluid mosaic model. This is what was given by Singer and Nicholson. These were the scientists. Nicholson. So that is the model which was given by them. So now we know these four components. Let's add something to that. The in-between space, the space which is quasi-fluid nature, the space which is in between, now that is where the cholesterol is there. So that one is cholesterol. Step by step, we'll just make the complete cell membrane. So this particular cholesterol, they are affected by some factors. Now, which factor they will be? So we are interested in the fluidity. We are interested in we are interested in fluidity of our cell membrane because it will keep this good. Right? So first is the temperature. As the temperature rises, the fluidity rises. Right? Second, as the cholesterol level increases, now today you'll be getting answers of so many routine questions. Right? If the cholesterol level increases, what would happen? Now the cholesterol, if it is this much, right, this much, so they won't be able to slide. They will be tightly packed. Right? They will be tightly packed. So increased cholesterol, that will lead to fluidity and would decrease because tightly packed. In these entire notes, there would be only the keywords. There won't be even a single running long sentence. No, they will not be there. And you will actually revise it like that. And today, by the end of the session, we'll revise also at a high speed. Just in 5 minutes, how to revise. So that will answer some of the questions that is after completion of the class, how to revise. The screen and voice is lagging. No, I think it should not lag. It should not lag. Because the bandwidth over here, so it is absolutely fine. Just a question to everyone. All good? Not. It's happening with only one person, right? So you need to check your connection. Yeah, I got more than 30, 35. Yes. So it is all good. Please check. The third is regarding the fatty acids. These fatty acids will be divided into two parts, and as we talked previously also, saturated and unsaturated fatty acids. We'll be diving deep into this. So saturated fatty acids, they are bad, and unsaturated, they are good. Just for our purpose. When we'll say it decreases fluidity, so yeah, that now makes sense. Right? Because any fat which is decreasing the fluidity, so that means it is just killing the whole purpose. While over here, this will increase fluidity. So this will draw like this, that is the saturated, and for unsaturated, they are a bit flexible. So draw it like this. Now we move on to that special area, right? This special areas. Cell is a live structure. Right? Cell is not a dead structure. That means there has to be the constant communication between outside world and the inside world. So very quickly, if you draw it like this, so this is the cell wall. There are few proteins. Which would like to communicate. One of such protein is, it starts from here, goes down, goes again up, goes down, up, down, up, down. How many times? 1, 2, 3, 4, 5, 6, 7. On 7th attempt, it's over. These are called as the 7 pass receptors. These are the receptors. Just in a minute, we talk about what is receptor. But they go through 7 times. They are also called as the GPCR. GPCR, G stands for guanosine. Right? P stands for protein. C stands for coupled. R is for receptor. So G protein coupled receptors. Same name, right? It is the same thing. It is called as 7-pass receptor. It is called as G protein coupled receptors. It is called GPCR, or it is also called as the serpentine receptor. Right? Serpentine receptor. This would be the symbol for receptor. Doesn't matter, they all are same. But this is like they are called as, yes, you are right, this is called as the integral protein. When we say integral protein, that means if you try to take it away, right, you break the cell wall. Break the cell wall. We won't be able to separate this from the cell wall. They are that superbly integrated. So we use the word receptors. We use the word receptors. So what exactly we understand by receptors? That's the cell membrane. Now we'll be drawing it simple. And this is our receptor. That's okay whether it has passed 7 times or it is 1 time, whatever. But basically, this is something which is one end is outside and one end is inside. Right? Over here, there is one sensor center who is just listening. And over here, we'll be giving some response. Just so these are the receptors. This whole thing is receptor. And this area where something would come and it would be activated, and that is called as the ligand. Ligand means what? Ligand could be a hormone. It could be an enzyme. Right? It could be an enzyme. It could be a poison. It could be any chemical. It could be any drug. anything which comes over here and it activates and its effect is seen inside. So this is activated here and effect seen inside. This arrangement is necessary because not everyone can pass through the cell membrane. This one is the cell membrane. And the effect is what effect has to be some sort of biological function. Right? Some biological function should occur, and then we call this as a receptor. And whosoever is stimulating it, it is called as the ligand. So, say for example, all those neurotransmitters, they cannot go inside. Say for example, epinephrine. So epinephrine, it cannot go inside. So that has to, right, it can't go inside. But it wants to stimulate some of the protein synthesis inside. So that's why receptors, ligands or something. Receptor is a total structure. Ligand is someone who is activating. So epinephrine, adrenaline, right? Epinephrine, adrenaline, they are called as the ligand. Ligands, they are the hormones, enzymes, poisons, drug, anything which is stimulating it outside, and effect goes inside. Right? So that is what is called as the ligand. So this is good. Now there would be some substances which can enter the cell. Right? So those who cannot enter the cell, for them it was this 7 times. So they will just come over here and they will say, okay, this is the message. There are message under there, and the message would be given and the process would start. Some of them, they will say, who can stop? Right? So they will just enter. So substances can enter too. Not all, but some. So for them, there is intracellular arrangement, and that is called a so it will go inside, and that's where it will keep on working. So these receptors, one, what is called as the pass-through receptors. They are also called as the pass-through receptors. So they are like integrated protein. You just can't. Why you are starting all this unnecessarily? Then stop it. Else I have to ban. So pass-through protein, okay, it will come again. Integral protein this is the cell membrane, and this 7 times it has gone inside. So now this is the part of it. If you try to remove this protein, right? If you try to remove this protein, you will break the cell membrane, but that protein won't be separated. Right? So that is what is called as the integral protein. All these are named pass through as it is passing through the cell membrane. Same, it is also called as the transmembrane protein. See, transmembrane, something which is passing through the membrane, right? Which is passing through the membrane. And that's why pass-through proteins, transmembrane proteins, they are the integrated proteins. It's all one and the same thing. These are the characteristics. Now, when we look at this with this perspective, this is the cell membrane. Some proteins are here, but they are just outside. Some proteins, they are inside. So they are called as the attached protein. So this is outside. So it is just outside. It is not going inside. Someone who is inside, so it is inside only. It's not going outside. Such proteins, we'll call them the attached protein. Attached protein. So easy. Good name, attached proteins. They are also called as the AKA, they are also known as peripheral proteins. They are the peripheral proteins. Now, if you want to, they are not integral protein. So if you really want to remove them, yes, you can be removed. They can be removed. And when they can be removed, we can't call them the integral protein. So we'll just say that they are loosely attached. To remove, let's say you want to remove, two things are very common. One, the pH change from acidic to basic or basic to acidic. These proteins will be detached. Or you use some ionic combination, right? Especially if you come into picture when we are studying about the pharmacology. But these proteins, they are manageable. They can be removed. Right? So when we say the integrated protein, so that's 7-pass receptor, Some of the enzymes, receptor, they are also for that. Then some of the proteins, they'll be the carrier link. So what carrier link will say? Here it is. You'll say, I want to go inside. But let's say if there is a carrier protein available, so you'll say, okay, I'll take you, and it takes it inside. Carrier protein is when these are like, they support transport of some substances. Then fourth, cytoskeleton support. Because these carrier proteins, they are tough, so they give support to the cytoskeleton. And yes, some of the proteins, not everyone is 7-pass. There would be some 1-pass receptors. 1-pass. So they are just going like this. Here is the ligand, here is the messenger, right? And 1-pass receptor. Peripheral. So when we say cell membrane, so in cell membrane, there would be more. Normally, proteins are more. Protein is more. In fact, this is as compared to the lipids. So this one is the 55%. This one would be by 45%. But when there is one exception. Except whenever the exception comes through, because they will be the favorite questions of exam. Now here is the nerve. So what I'm trying to draw, this is the nerve fiber, and these are myelin sheath. It is the myelin sheath. Yes. So this myelin, it improves the speed of the conduction, and this in between space, this one, that is called as the node of Ranvier. Node of Ranvier. Not all the nerves, they are like this. So if they are like this, they are called as the myelinated nerves. And obviously, if this myelin is not there, it is called as unmyelinated. The point is that when we are discussing protein and lipids, in these nerve cell membranes, which are myelinated, the lipid they are much more as compared to protein, because here it is 80%, here it is shear. So do take care of this part. So more lipids. So here is the lipids. We talked about one standard phospholipid because that is the maximum. So phospholipids, they are the max. Now they are the now cell, because you have seen the histology of nerves. So they are covered by myelin, or if they are not covered, they are called as a non-myelin. So then comes the carbolipids. Carbolipids, other name is glycolipids. So this is glycolipids. And the third one is the cholesterol. So cholesterol is precursor. It is precursor of vitamin D. And this is what you can easily get from sunshine. Now for all these, the first, the phospholipids. This is 1, this is 2, this is 3. So in case of phospholipids, we had got the 1 phosphatidyl. We start with choline, which is the external, right? Phosphatidyl choline. Its another name is lecithin. Now this lecithin, see, our lungs, they are super lazy. Our lungs are super lazy. Lungs always feel like, I want to collapse, I don't want to work. And chest is over enthusiastic. You'll say, I'll just expand, right? I don't care what lungs are. So chest tries to expand and lungs try to collapse. This is what normally happens. But it doesn't happen. That's because there is substance called surfactant. This is what comes into picture. So this lecithin, this is a major surfactant. So this surfactant will keep the membrane so that oxygen transfer, carbon dioxide transfer can be occur. So that is a major surfactant. The second one, this was phosphatidyl choline, and the second one, it is called as the sphingomyelin. So sphingomyelin, that is also a surfactant, but it's a minor surfactant. This is a minor surfactant. So now we have got one major surfactant and second is a minor surfactant. Their function, it goes to the alveoli, right? This alveoli tells, yes, I want to collapse. But this surfactant, which is lying over here, this won't allow it to compress. So this it keeps into the state. Or down. For some reason, if lecithin goes down, so this will definitely collapse. So the sphingomyelin is a minor surfactant, but still it is. So sphingomyelin and lecithin. Now, because we know that yes, there is difference between, say, lecithin and sphingomyelin. So in obstetrics, when it is your responsibility that the baby which is baby of that pregnant female, that should come healthy. Right? So you want to just check that whether the lungs of that baby are normal or not, right? Whether they have matured enough or not. So this particular condition is for fetal lung maturity. Fetal lung maturity. Why you want to do this? For some reason, it is necessary that we need to deliver the baby earlier. So lungs should be obstetrics. Obstetrics is that science which deals with the birth of the baby. Right from the conception, that first when the ovum and sperm meets, all the way till the baby is born. This entire thing it gets covered into obstetrics. So in obstetrics, when the baby is getting formed, yes, you keep on doing the ultrasound time to time to figure out, yes, things are going good, baby is healthy. Right? So over here, baby is still inside. You want to figure out whether the lungs are matured or not. But think about this, baby is not breathing. Baby is not breathing because baby is soaked into amniotic fluid. It is that amniotic fluid what baby drinks, and it is that amniotic fluid which comes out as urine. So baby is sitting into its own urine, right? And it is extracting nutrition from that. That thing is getting exchanged from the mother. So new nutrition comes, but it gets mixed into that pool only. So when the baby is sunk into water, then baby won't be breathing. Yeah, it cannot. Right? So from where the oxygen would come, that is what we'll see in fetal circulation, that how smartly it comes and it supplies oxygen to the baby so that baby grows. But okay, lungs are not functioning. But will those lungs function when the baby will be taken out? And that is what is called as the lecithin sphingomyelin ratio. This is what you, right? How will you do? You just take a syringe, right, under ultrasound guided, so that you are not damaging the baby, and you just take the amniotic fluid out. Right? It is called as the amniotic fluid. Amniotic fluid that is taken out in small quantity, lab tested, and then you'll find that yes, what is the ratio? This ratio, it has to be more than 2.0. It has to be more than 2.0. So this would indicate that lungs are good, lungs are happy, lungs are matured. So that's why this test is also called as the shake test. Shake test. Shake test because when it is taken, right? So then it is shaken. Then we see whether the bubbles are formed or not. So it is called a shake test. It is also called as the bubble test. Bubble test. It is also called as the end Clement test. It is also called as the Clement test. So all these are names for same one. Right? So sphingomyelin and this lecithin. So over here, lecithin is a major, sphingomyelin is a minor surfactant. So that's how things they should go. So if sphingomyelin is a minor surfactant, then what is the use? Right? What is the use? So that is the myelin in nerve cell membrane. Just a minute. Still. Sorry. So amniotic fluid. Now it will start. There was someone at the door, constantly ringing the bell. So this is the amniotic fluid, which is taken out, and we see the ratio is more than 2.0. And then how this test is done, it is that test tube is shaken, right? And then we see that whether the bubbles are formed or not, and how the bubbles are formed. So this test is called as the Clement test when the bubbles are formed. So depending upon that, it is said that whether the maturity is there or not. And this is one of the important tests. I've described this thing in very brief, but just to show the importance of these lecithin and sphingomyelin. Right? In obstetrics, we'll be going through all the stages and how are the bubbles formed, whether the bubbles are formed at the edge, how many bubbles are there, right? And accordingly, you can really say that what is the level of maturity. Right? But remember this much, at least at this point of time. Phosphatidylserine, right? The third thing is called as the phosphatidylserine. This phosphatidylserine, that is very interesting, right? Here is the cell membrane, and phosphatidylserine is sitting over here. It will be inside only, right? Inner only. It is inside. If it goes outside, right? This is your extracellular fluid, and this one is the intracellular. Now, if this goes outside, so then as it lands over here outside, so it sends a strong signal, and that signal is eat me, kill me. It will say this signal. That means there is some major break, and this phosphatidylserine should not be exposed. The moment it is exposed outside, it will send this eat me signal. Eat me signal, that is in technical thing, it is called as the apoptosis. Apoptosis. Apoptosis means cellular death, a planned cell death. Right? Planned cell death. But how do we really know about it, that whether it is happening or not? Say all these cells, right? Under normal circumstances, it won't happen. All right. Can't hear you. Hello, hello, hello. Testing 1, 2, 3. Because Alisha, no one has complained. So, okay, clear. So others shouldn't be having any problem. Otherwise, it would flood with the messages. Yeah, clear. All right. Alisha, just check, please. Just check. So this is called as the plant cell death, cell dies. But what if we really want to see this? Because here, when the cells they start dying upon itself, that will lead to some major complications. Right? This is when the cells they start dying like this. When it happens, see, there is one more protein. It is called as the cellular protein. This protein is sitting silently. Its name is annexin. Its name is annexin 5. This is sitting silently. But the moment it finds that this phosphatidylserine, right? It has said that was जीने की इच्छा नहीं, right? Apoptosis, eat me, kill me, right? That signal, so it goes and attaches to phosphatidylserine, and it will make a complex. It is called as the annexin 5 phosphatidylserine complex. So this is not so like that out of sympathy, this annexin 5 has gone. NXE5 has gone to declare that, okay, that's it. Now this is the complex which should be killed, which should be destroyed. But can we really see this? Yes, it can be seen. Can be seen. And for that, there is a special kit which is available. That is called as the Alexa, right? Alexa floor 488. And this is a kit for NXE5. NXE5 kit. So with this kit, we'll be able to demonstrate whether there is presence of NXE5 PS complex or not. And that's the reason it is called as the apoptosis indicator. Apoptosis indicator, that means cellular death has started. Right? So this is called as apoptosis indicator. We need these indicators to really know whether the cellular death is occurring or it is not. So this was one. The next one, so we talked about, say till this point, phosphatidylcholine, sphingomyelin, then we went into the inner wall phosphatidylserine. Now there is one more which is called as the IP3. IP3. This is what is called as phosphatidyl inositol. Phosphatidyl inositol. This is very difficult. This is cell, right? Cell membrane, and there is the receptor, and then over here, someone comes, that is a ligand comes, and it tells the boss has said, do this thing inside, right? So over here, inside, something happens. So this ligand would be called as the first messenger. First messenger. Right? Because it has acted on that particular receptor, which is called as first messenger. And then whatever happens inside, right, that one is called as the second messenger, because it is the second substance which will go to various parts of the cells and will say, okay, this is the message which has come from outside, do this and do that, all those things. And this second messenger is nothing but IP3, inositol, phosphatidyl inositol. This is classically in case of hormones, right? So basically this is like hormones. So thus it will be affecting the endocrine system. Right? So far, all good. There is one more which we must mention, and that is called as the cardiolipid. It's called as the cardiolipid. It looks like as if it is coming from the heart, but this is something which is exclusively, it is exclusively in mitochondria. And in mitochondria, there is, this is how we draw the mitochondria. There is cyclic AMPs are there. So this is the mitochondria membrane. So that's where this cardiolipid is there. That's where the cardiolipid is there. Now some of the organs, right? Some microorganisms, they form the antibodies. They form antibodies against this cardiolipid. So antibodies against cardiolipid. This concept will come again and again when we will be discussing the immunology. But remember this, that someone who is staying happily and suddenly that dushman comes. So this antibodies, they come. When they are coming, so there would be a specific reason. So which organism is doing this? So that we try to detect with the presence of anti-cardiolipin antibody. Right? So we do a test. We do a test. What's the name of the test? Just start. But this test will detect what? Detect anti-cardiolipin antibodies. So antibodies against the cardiolipin. If it is present, that means this person is suffering from syphilis, which is a sexually transmitted disease by Treponema pallidum, right? Syphilis by Treponema pallidum. Now, how this Treponema pallidum will actually act, etc., it will come when we'll be talking about it in microbiome. But there is presence of anti-cardiolipin antibodies, and that's why this test is VDRL, Venereal Disease Research Laboratory. It's the Venereal Disease Research Lab. That's called as the VDRL test. So this is what we saw, that these are so crucial. Right? They actually lead to some of the diagnosis also. So this, our final topic is glycolipids. Now in glycolipids, where they are formed, right? One is the ganglioside, and then there is cerebroside. Whether it is ganglioside or cerebroside, you will find that into the brain. Right? And in brain, it is found in large quantity. So that was glyco, and the cholesterol, which we already talked about. Now we'll just add some information. And what we said, that cholesterol is what? Cholesterol is precursor of vitamin D, right? It's called as precursor of vitamin D. And this vitamin D, this cholesterol, it maintains fluidity. Right? So this fluidity is important. Now for this fluidity, said that it is divided into two parts. There are some things which are increasing the membrane fluidity. There are some things which are decreasing the membrane fluidity. So those who are increasing membrane fluidity, that means they are good. So those good were what? They were unsaturated fatty acids. Correct? They were unsaturated fatty acids. And at times we remember, like U is Uttam. Uttam means Hindi. Uttam means first class, good. So they are unsaturated fatty acids. You must see this thing. In what names they will be given. You'll find that on the food packets, on the backside, sometimes they write too far. So that means this is unsaturated fatty acids. So that is good. Then you might see what's called as the essential fatty acids. These are the essential fatty acids. You will get the answer in just 2 minutes, that why these outside foods are bad. Just in 2 minutes you get the answer. So these are the essential fatty acids. Essential fatty acids are like linoleic acid. You have to remember this. Then linolenic acid, and very, very vital, arachidonic acid. So if they are present, life is good. What about other one? Let's see, something who is decreasing membrane fluidity. And they are the big two culprits. These are the saturated fats. Sada hua, right? Saturated. One, stearic acid. Stearic acid. Another one is palmitic acid. Now these food makers, they are so smart that at times they won't write saturated fatty acids. They'll just write stearic acid, palmitic acid, that sort of thing. Recently, I purchased the bread, and under it, I was like, wow, this was what? Some special bread. Not the brown bread, but I just missed something. Some jowar bread, no, multigrain to something. But it was highlighted in big areas that it is a jowar bread, vagere, vagere. When I read, it was 3% jowar, and it was 97% the normal atta. But the advertisement, advertise it like that. What are you asking? Do they decrease cell fluidity? True, that's what I was at. That this is that decreases membrane fluidity. So what is this membrane fluidity? Because when the membrane fluidity decreases, that cell membrane is liable for break. Right? So that's why all these things, they are called as the aging. They really increase your age. Right? Now, the concept which you must understand, right? The last concept, and that is the transition. Why they say that such bad oils, they get deposited into our body, into the blood vessels, and then they lead to atherosclerosis and whatnot. And there has to be some scientific foundation. So this is a concept, what is called as the transition temperature. Transition temperature, right? Just dhyan se samajh. This is solid, and that substance becomes liquid. Right? So this is solid lipid, and this is the liquid lipid. Till it is liquid, the things are fine. It will be metabolized, it will be accepted. If it is solid, well, it won't go. The temperature at this thing occurs. The temperature, right, at which this solid turns into liquid, that temperature is called as the transition temperature. Right? So not very complicated. Okay. Now comes the transition temperature. Right? This transition temperature is inversely proportional to fluidity. Inversely proportional to fluidity. So if the transition temperature is high, then fluidity would be less. If the transition temperature, that is at a lower temperature only, this solid is getting converted to liquid. So in that case, its fluidity will be better, its fluidity will be higher. Makes sense, right? Because sooner it will become liquid, then the gliding motion will start. So this is the thing, that palmitic and stearic acid, what they really do, because their transition temperature is much higher than the body temperature, so they will be going and they will be getting deposited. They will not be like a free fluid, they will be getting deposited. They will be converted into the fluid at 107 degrees. That means if someone is having fever at 107, then they will start melting. Otherwise, so they'll get deposited. This is the trouble. So fluidity, right? This fluidity, it is more when the transition temperature is less, and that is what you see in unsaturated fatty acids. And who uses it? No one, because they said that is very expensive. Fluidity decreases at higher temperature This is what we see into this saturated fat acids. Saturated fat acids. If there is any that nashta or any of those ready-made foods are available, just see the ingredients and you'll find that palmitic, stearic acid, that they are in that is all there. So this is cholesterol, as we said, that is in between. Right? So cholesterol, it tries to maintain fluid. That's why it is called as the fluidity buffer. Right? Fluidity buffer. Though they are not, say, these saturated fatty acids, they are not supporting, right? But cholesterol tells that no problem. Irrespective of temperature, it neither increases nor decreases, no effect of temperature. No effect of temperature. So that's how it really works well. So this is what really happens in our body. But the carry home point is, right, remember this. Right, those wafers, those chips, right, all sorts of junk foods, they all are having palmitic or stearic acid, that palm oil, right? It is there. Now they all are saturated fatty acids, and thus they will be affecting the body so bad because it is a gradual. So it will keep on getting deposited. So it's not in one day it will happen, right? But it will keep on getting deposited, and then gradually, say, the day it happens, like the caliber is decreased, then it leads to complication. If at this age, right, at the age of 20, the body is in its most powerful state, so just stress yourself, some stress to yourself, run, right? And then you will realize that are you breathless? Is there any shortness of breath just after running about a kilometer or so? So this is the point when you have to wake up, right? If you are eating outside food or junk food, or if you have eaten anything in the past, so you need to take care of it. So this much is for today. And as I said, that we'll be revising it at a high speed, right? So just within 5 minutes, we'll revise it at every point. And this is the way to revise. What I was talking about was that sleep learning, right? In sleep learning, the idea is that this is the phase 5 minutes before you go to sleep. This is the phase when 5 minutes after you wake up, and done, right? This is the speed at which you will be revising it. And thus, that much time is what we'll give. So let's start, and we'll start with the time. I'll start at the time. This is cell membrane, or we'll be discussing. Okay, these were the questions. Most important was cholecalciferol, 60,000 international units, less than 10, so then take it twice per week, and then that's what you have to eat for 1 month, 10 to 20, once per creatine monohydrate, right? Quite specific. So here comes the cell membrane. It is a bilayer phospholipid, and in that, this is polar. So this is polar. This is polar. That means it is charged, and that is hydrophilic. And this in between is the hydrophobic or the lipophilic. Protein 55%, carbohydrate 5%, fat lipids 40%. And the idea is anything which is lipid soluble, small molecular weight, and the neutral, uncharged, so they can cross easily. Right? So we need to go for special arrangement for water soluble, large molecular weight, and the charged particle. For that, let's start with the water. For water, it was like we make a channel through which the water can pass easily, and that is why it is called as the aqueous channel. Cell membrane divided into outer part and the inner part. Our outer part is phosphatidylcholine and the sphingomyelin. Inner part, that is the phosphatidyl ethanolamine and the phosphatidylserine. Right? That is what is called as the membrane asymmetry. Outer half is not exactly similar to the inner half. they market it as healthy. So that's what I'm telling, right? That's what I'm telling, that they market it as healthy, but this is the reality. Because on picture, they put good pictures. Inside the contents, they are so harmful. I mean, if you are making anything at home by yourself, right? At the end, just let's revise this, right? And then I'll say something for the food. Actually, what I yes, I'll tell. So here it is, phospholipid molecule, right? Fluid mosaic model. So it glides, right? So it glides. In between, there will be cholesterol. So if the cholesterols are more, so again, things are packed and it will decrease the fluidity. Higher temperature, right? And the fluidity increases in this case, right? Higher cholesterol, fluidity decreases because it is the tightly packed, right? If the cholesterol is more. Fatty acids saturated, so they decrease fluidity. Unsaturated, they increase fluidity. Right? So these are the special areas. These are the receptors, 7-pass receptor. They are also called as the GPCR. This is G is guanosine protein coupled receptors, and they are also called as the serpentine receptors because of the shape. Integral protein, because this protein cannot be removed. If you try to remove it, it will break. Then there are receptors, and on these receptors, when over here, right, if there is any stimulus, and that is why ligand, this is hormone, enzyme, poison, drug, all those things, but they will send the message inside, and that effect is seen. That biological function, if it is seen, then we'll be calling this entire structure as a receptor. Right? Some substances can enter, some substances cannot. Those who can enter inside, for them, the platform is ready for the intracellular, right? They are welcome, and they'll say, yes, you start acting, and say, example is thyroxine. So they are also called as the pass-through receptors or transmembrane receptors or integral protein receptors. Then there are some other proteins which are connected either on the outside or in the inside, and that's why we'll be calling them the peripheral protein. These proteins, they can be peeled off, they can be removed, and they are loosely attached. To remove, you either change the pH or you change the ionic combination, and they will be released. Integrated protein, 7-pass receptor, enzyme receptor, carrier link, cytoskeleton support, 1-pass receptors. All these are integrated proteins and their functions. Cell membrane, we have got 55% protein and lipid is 45%, except in case of nerve fibers, right? In case of nerve cells, this is myelin sheath. These myelin sheaths, they are having more of the lipids as compared to protein. So lipid is 80%, protein is 20%. Lipids are divided into phospholipids, carbolipids, and cholesterol. We'll talk about all three of them. Phosphatidylcholine, that is also known as lecithin, it is a major surfactant, and it prevents lung collapse. Right? That's the role of surfactant, because it keeps the membrane stretched so that it doesn't collapse. Right? Sphingomyelin, that is a minor surfactant, but there is an LS ratio. Lecithin sphingomyelin ratio, that ratio will tell us something whether the lungs are matured or not. So in obstetric, that is the science where the birth of the, up till the birth of the baby, right, that is taken care of right from the conception. For fetal lung maturity, we want to see, so this is the LS ratio, should be more than 2. Here the fluid is taken, that is the amniotic fluid. And this is AKA, also known as shake test or bubble test or Clement test. Right? Next is this phosphatidylserine, found only inside. If it is outside, then this cell would say, "But now I don't want to live," right? And it will say, "Okay, come someone meet me." This is technically it is called as the signal of apoptosis. Apoptosis means planned cell death. The whole process would start, and gracefully this particular cell will be destroyed. For this is one of the steps. This annexin 5, right? Annexin 5 is sitting silently, but the moment it tells, correct, this messages come, it will run and it will attach to it. A complex is formed. Now, once this complex is formed, this complex has to be broken along with the phosphatidylserine, and is broken. So this substance, it can be. So then we decide, when we can say that this is the apoptosis indicator and the cell is dying. Elexaflor 488 vaccine 5, that is the kit. IP3 phosphatidylinositol, this is for hormones. That's it. That's what you have to remember, that this is the second messenger in the form of hormones. Cardiolipin exclusively into the mitochondria membrane, and sometimes microorganisms, they make antibodies against cardiolipin, right? Antibodies against cardiolipin, and this is what we detect in the VDRL test, Venereal Disease Research Lab test, and this is anti-cardiolipin antibodies. And you will find these things in the patient of syphilis, which is a sexually transmitted disease by Treponema pallidum, right? So this test is done for that, because sometimes they say they just take the blood, but what do? They detect specific chemicals. If they are present, that means that particular disease is there. Glycolipids, ganglioside and celluloid, presence in brain, and finally this is the cholesterol, which is precursor of vitamin D. Fluidity, increased membrane fluidity, that is good. Decreased membrane fluidity, that is bad. Increases by unsaturated fatty acids in the form of PUFA, that is polyunsaturated fatty acids, and the essential fatty acids, linoleic acid, linolenic acid, and arachidonic acid. Right? This is white arachidonic acid. It can come at so many places, and many of the drugs they will be active on it. And decreased membrane fluidity is of saturated, that is stearic acid and the palmitic acid. The concept of transition time is that time when the solid gets converted to liquid. So if this temperature is high, the idea is that transition temperature is inversely proportional to fluidity. So if this temperature is high, that is at a higher temperature, it will be converted to liquid. So that is till that point that it will remain in the form of solid or the semi-solid. That is what is getting deposited into our arteries, right? That's why this is bad, because those arteries, those walls, right, they will become rigid. They will not be that flexible. So when the more blood is needed, so they won't be able to expand, right? They will remain that much only. Heart is getting less blood, heart will start crying. The cry of the heart, that's nothing but angina pectoris. Angina pectoris is cry of the heart, because I am dying, right? So that is a pain, right? Nothing has happened. Abhi bhi sambhal jao. No pain, right? No problems. So the angina pectoris is without damage to the heart has given the indication. That's why we always say that it is the cry of the heart. Don't blame me if anything is wrong. So that is the thing. So here it is fluidity, it increases when the transition temperature is low, and this is low in case of unsaturated fatty acids. So even if it is consumed, right, olive oil, right, even if it is consumed, but at a lower temperature, it will be converted to liquid. So it will remain over there, it won't harm. Fluidity decreased when transition temperature is high in case of palmitic and stearic acid, so saturated fatty acids, right? These are the things. Cholesterol, they maintain fluidity because for temperature, there is no difference, right? They are not affected by temperature, so they will try to maintain the fluidity as much as possible, and that is the fluidity buffer. Cholesterol is not affected by temperature. Right? There is no effect of temperature in case of cholesterol. No effect. But if the cholesterol is more, they will physically they'll fight, right? They'll say, I am big, right? They won't allow that side to side slide. So if the cholesterol is more, cholesterol is a wonderful fluidity buffer. But when it is more, so it will tighten the cell wall. Right? So that's why that should not be higher. Otherwise, cholesterol, it won't be doing anything wrong with the increase or decrease temperature. But those fatty acids, they will be thus. So that was we took slightly more time. So that was a quick revision. Right? I'll put this thing into our that shared folder. Right now, I'll be putting it. Okay. So thanks a lot. Thank you so much. And we meet soon. I can see some emails. I'll reply to this. PDF. Should I share the link also right now? Just wait. Let me share the link. I'll share the link. So that's the link. Let's put this file right now, so you'll be able to see it. Acha, general and systemic physiology. General physiology, where what we are learning. These principles, they will be effective on all the other systems. Systemic physiology means what? Say, for example, renal physiology. So in that, we'll be discussing in and outs of kidney. When it is GIT physiology, we will be talking about the GIT full, gastrointestinal tract. Correct? Can we for ebook of BD Chorasis 6 edition? This is good. No problem. Unless and until you are buying new, that's it. I'll just put this file just. Okay. That file has been placed, uploaded. Yes. You should be able to see this file. But the next time I'm thinking of taking sodium potassium ATPase pump. All right. Okay. So thanks a lot, and we meet soon.